Artificial Intelligence Dr. ABC Pharma Net. Troponin and natriuretic peptides after heavy exercise in older adults. After truly heavy exercise, both cardiac troponin, HSCTN, and natriuretic peptides, BNP/NT-proBNP, can rise transiently in older adults, even without overt heart disease. What typically happens? Troponin, HSCTN small to moderate increases are common after prolonged/intense effort. Values usually peak within 3-6 hours of stopping and return to baseline within 24 to 72 hours. This most often reflects reversible membrane/cytosolic release rather than necrosis. Natriuretic peptides, BNP/NT-proBNP, often rise immediately post-exercise from transient wall stress and volume/pressure load, then decline with recovery. Elevations are typically much lower than in acute heart failure. Age and comorbidities, e.g., renal function, independently raise baseline NP levels, so older adults start higher. How to interpret in the elderly. An isolated post-exercise HSCTN above the 99th percentile equals myocardial injury, not necessarily infarction. Myocardial infarction, MI, requires a rise/fall pattern plus ischemic evidence, symptoms, ECG changes, imaging. Use serial testing rather than a single value. Recent population and athlete data, including middle-aged/older cohorts, show these post-exercise troponin spikes are common and usually benign, not clearly linked to silent CAD when occurring in otherwise well people. When to worry/practical approach. Symptoms or signs of ischemia, syncope, persistent dyspnea, or new HF signs evaluate as an acute syndrome, ECG, repeat HSCTN at 1 to 3H, consider imaging. Kinetics matter. Values still rising after 3 to 6H or not trending down by 24 to 48H, or rising with ischemic ECG changes, investigate for MI or other pathology. Very high or persistently elevated NT-proBNP, especially with symptoms, warrants HF workup. Remember age and renal function shift baseline upward in the elderly. Bottom line. In older adults, transient bumps in HSCTN and NT-proBNP after strenuous exertion are expected and usually benign, peaking within hours and resolving over 1 to 3 days. Diagnose disease by the pattern over time and clinical context, not a single number. Explore more at Artificial Intelligence Dr. ABC Pharma.